Welcome to the About the Face podcast, sponsored by the American Academy of Facial Plastic and Reconstructive Surgery through the Facial Plastic Surgery and Aesthetic Medicine Journal.
Hi everyone, my name is Travis Clarke. I am an otolaryngology resident at the University of Tennessee Health Science Center in Memphis and a co-author on our new study titled Measuring the Impact: Pilot Validation of a Novel Patient-Reported Outcome Measure for Craniomaxillofacial Trauma. I would like to introduce my co-residents and primary author on the study, Dr. Aaron Zebolsky, as well as Dr. Anas Eid, the principal investigator of the study and chief of facial plastic surgery at the University of Tennessee Health Science Center. To get started, Aaron, what motivated you to start this project?
Thanks, Travis. Yeah, I'm really excited to chat about this project. I've always been interested in patient-reported outcome measures, or PROMs. I love the idea that we can use these instruments to take something qualitative like the patient experience and then quantify it, give it a number that we can use to interpret in a clinically or statistically meaningful way. When I first started taking care of facial trauma patients as a resident on primary call here in Memphis, I wanted to start some patient-reported outcome studies and better understand their experience, but I realized that we don't have any good instruments in order to do this, so I thought it'd be a good idea to try to make one. I proposed the idea to Dr. Eid, he helped me refine it, and then a couple years later, here we are.
That's great. Dr. Eid, could you elaborate on the specific gaps in facial trauma care that a PROM may help address?
Certainly. In the majority of facial trauma literature, successful reconstruction is typically defined by objective assessment of postoperative CT scans, the need for revision procedures, or the presence of clinically evident complications like, let's say, malocclusion, infection, or paresthesia. However, our understanding of how these outcomes truly affect patients remains limited. Importantly, patients may experience issues that are often overlooked during routine follow-ups, like concerns about facial aesthetics, mental health, social interactions, and self-perception. Patient-reported outcome measures, or what we call them PROMs, can help standardize our approach to patient care by ensuring these critical aspects are addressed. Additionally, they provide valuable data to enhance research and improve overall clinical outcomes. This is why, when Aaron presented his idea, I was very excited about the study.
Thanks, Dr. Eid. So, can you guys give the listeners an overview of the study design, including how we came up with the structure for this new survey instrument?
Yeah, so this was a mixed method study. We started with a literature review, expert opinion, qualitative patient interviews, and then did a prospective survey validation portion. We started with a scoping review that our group recently published, looking at some of the major PROMs that have been used in prior facial trauma research. There's a ton of different instruments, but some of the most common were the Hospital Anxiety and Depression Score, or the HADS, the Oral Health Index Profile, the OHIP-14, many of the FACE-Q scales, and several other instruments. We found a lot of key domains, including psychosocial function, facial appearance, and pain. So we used these categories to create the sections of our facial trauma survey. When we broke down the heterogeneity of facial trauma and facial fractures, we figured out that there's really three functional units that all physical symptoms can be attributed to. These were the nasal region, the orbital region, and the jaw region. So we created modules for each of these regions, and those had functional and aesthetic subscales within them. We also created a fourth general module that was designed for all patients with facial trauma, covering broad symptoms like pain and psychosocial functioning. So this gave us the overall 4-module design. We then populated it with some items that were adapted from these prior survey instruments and refined it based on qualitative feedback from our otolaryngology faculty, from our OMFS team, from Flesch-Kincaid reading levels, and then patient interviews as well. We had several different names that we thought of throughout the process for this project, and ultimately landed on the IMPACT, the Integrated Modular Patient-Reported Outcome Assessment for Craniomaxillofacial Trauma.
The modular format of the IMPACT allows us to address the diverse range of symptoms experienced by facial trauma patients. The type of facial injury the patient suffered determines which modules they receive. All patients with facial trauma complete the general module, while the nasal, orbital, and jaw modules are assigned based on the location and nature of the injury. For example, patients with mandibular fractures complete the general and jaw modules. Those with nasal-orbital ethmoidal fractures complete the general, nasal, and orbital modules. The patients with zygomatic fractures receive the general, orbit, and jaw modules. Patients with extensive injuries, let's say like Le Fort 3 or panfacial injuries, complete all 4 modules. We also have developed a user guide to kind of clarify which modules should be completed for each type of facial trauma.
For everyone listening here, the user guide is published as a supplement with our manuscript that you can access through the FPSAM journal. This also includes the entire survey instrument and scoring instructions. So next, Aaron, can you explain how this instrument was validated and provide an overview of our results?
Yeah, for sure. So we prospectively collected impact surveys in patients presenting for routine facial trauma follow-up within 3 months of their injury. Our primary objective was to determine if the impact scores accurately measure quality of life. In order to do this, we administered a control quality of life survey, the 15-dimension health-related quality of life survey, or the 15D. This is a well-established instrument for measuring quality of life and has been used in previous facial trauma research. We also compared the impact scores with objective measures of facial trauma, things like the Facial Injury Severity Score, the FISS, and the Comprehensive Facial Injury Score, the CFI. These measures use pre-treatment and exam metrics like number of fractures, comminution, displacement, and soft tissue injury in order to give an objective facial score, the severity of facial trauma. So in order to test our primary objective, the ability of the impact to measure quality of life, we calculated the multivariable correlation coefficient beta between the impact and 15D scores while controlling for potential confounders such as gender, the need for operative treatment, the amount of time that's elapsed from the injury, and then these objective measures of facial trauma. We also looked at Chrome box alpha in order to measure the reliability of the survey instruments. We had 53 patients who completed the survey and were ultimately included in the analysis with a variety of injuries, including mandible fractures, nasal bone fractures, as well as some more complex ones like ZMC, NOE, Lafort, and a few panfacial fracture patients. Overall, about half of the group underwent surgical repair, while the rest were treated non-operatively. After we controlled for baseline factors, we found a significant correlation between the composite impact score and the 15D with a beta correlation coefficient of negative 0.555. This indicates a moderately strong correlation between the instruments. Each of the 4 individual module scores, the general, the nasal, the orbit, and the jaw, individually correlated with the 15D. This showed that they were all correlated with quality of life. Chrome box alpha values of above 0.8 indicated high reliability for each module. Interestingly, impact scores did not correlate with the objective FISS or CFI scores.
The impact was then optimized using this validation analysis and qualitative patient feedback. Can you explain how this was done and what aspects of the instrument were changed?
Yeah, so what we mean by optimizing is that we essentially used real-time data from the study to refine the survey instrument. We primarily relied upon the Cronbach alpha value to identify items that were statistically redundant. For example, responses to how often patients felt embarrassed were pretty redundant with how often they were stressed or anxious, so we got rid of the former. We went through each module like this and eliminated many of the redundant items in order to make the survey shorter and easier for patients to complete. After this, we reran the statistical analysis and confirmed that these optimized versions of the modules still met the primary objective and correlated with the 15D quality of life independently. Then one final component of the study as a pilot validation was that we put in a free response section where we asked patients to describe any additional symptoms that they experienced from their trauma that were not found elsewhere in the survey. From this, we gathered that many patients have general symptoms like headaches, neck pain, and dizziness. So we added this general symptoms section to the general module. Also, many of the patients that had pretty poor impact scores actually stated that they were doing fairly well when you went in the room and asked them how things were going. So to try to measure this concept, we created an overall satisfaction question and added this to the general module as well. Now, both of these additions were incorporated after the data collection phase started, so these were not validated in this current study.
So these findings suggest that the impact is a valid and reliable tool to measure the quality of life in patients with facial trauma. Dr. Eid, what are the next steps for this project, and how do you envision the impact being utilized in future research?
As a pilot study, this is just the first step in validating the impact survey. We started by a small sample size from patients at a single institution, but our results were promising and warrant expanding them into a large cohort. We've already started the next phase that includes a multi-institutional cohort. Our goal is to expand this analysis with a much larger sample with diverse facial trauma patients from various centers across the states. This will allow us to assess how impact scores are influenced by demographic variables, injury mechanisms, and treatment-related factors. Additionally, we will be able to calculate the minimally clinically important difference, or MCID, and evaluate response to treatment, both of which are essential before using impact for hypothesis-driven research. Once formally validated on a larger scale, impact will have a significant implication for future research. You may notice despite the comprehensive AO guidelines, there is limited data supporting the one treatment approach over another. For instance, various types of fixation of mandibular fractures may achieve adequate postoperative occlusion, but PROMs could help us identify patient-preferred techniques. PROMs may also help us understand preferred methods for surgical decision-making for complex facial fractures. Ultimately, we envision the impact will enhance our understanding of patient outcomes and support the development of more patient-centered treatment plans.
To wrap things up, were there any findings that you guys found particularly interesting or surprising in this study?
One interesting finding was the complete lack of correlation between subjective impact scores and pretreatment objective facial trauma scores. We expected to observe at least a weak correlation between trauma severity and the impact scores, but to our surprise, this was not the case. It is possible that a larger analysis may reveal this relationship, but it may also suggest that trauma severity does not significantly influence patient-reported outcomes. These results have led us to further investigate how impact scores correlate with objective post-treatment measures, such as the quality of reduction and fixation. We are currently conducting a follow-up study specifically to address this question.
Yeah, I agree that was surprising. I was also really surprised by the discrepancy between impact scores and how satisfied a patient reported that they were during their routine clinical encounter. I looked at so many impact surveys before going into a patient room where the patients had poor outcomes, such as reporting they were very disappointed with their appearance or experiencing frequent trouble with eating and so forth. Then I went into the room and asked how they were doing, and they said that they were doing well. I was kind of surprised with the symptoms and how they did not necessarily correlate with the response to this question. I think it's tricky to explain this, but really highlights the importance of PROMs. Part of it is likely that many symptoms just don't impact a patient's satisfaction as much as others do. But another factor to consider is that patients may not always voice all of their symptoms during the routine encounter. So like Dr. Eid mentioned at the beginning, if we don't push further when taking a history, we're likely to miss many important symptoms and concerns for these patients. PROMs, such as the impact here, help us standardize this process.
Great. Well, that wraps up the discussion on our recent publication, Measuring the Impact, Pilot Validation of a Novel Patient-Reported Outcome Measure for Craniomaxillofacial Trauma. Once again, the complete survey instrument can be found in the supplementary files associated with the manuscript on the FPSAM website. We are currently conducting a larger-scale, multi-center validation of the impact. For anyone listening to this and interested in collaborating, please do not hesitate to reach out. We would be happy to provide all the necessary materials to implement the impact at your institution. Thank you.
We'd like to thank the authors for their commentary and thank you for listening to our podcast. If you'd like to explore more, please feel free to check out the article in print at the Facial Plastic Surgery and Aesthetic Medicine Journal or online. We'll catch you on the next one.